Hey, I'm Dr. Karnik. I'm from Austin, Texas. I'm a pediatric neurologist and practicing for close to 40 years. I'm going to talk about management of ADHD in children and adults. So, what we're going to concentrate is we're going to talk about medications, drugs that are available, how to use them, how they work, what are the side effects, and all that. At the end of this talk, you will get introduction to most of the medications that we use in clinical practice. So when we talk about drugs, I have written that there are three different groups, as you can see. The first one is stimulant. Second one is also a group of stimulants, but there are two different types of stimulant that we use. The first one is called methylphenidate group. Now, most of you know a classic name, and that is Ritalin. I'm sure many of you know name Focaline or Metadate or Daytrana or Contempla and various things. In other words, there are many products available. Majority of these products now are generic, so these names are sort of historic in 2018, whereas they were classic names at one time. So we'll see what they are as we go down. The second group, as I said, is also stimulant group, and that is called amphetamine. And a classic example in this group is Adderall, which I'm sure probably you know the name, Vyvanse, and there are some new ones that have come in market, like Adzenys, Dynavel, Mydayis, and we'll see what they are as we go down. Now, sometimes some children do not do well on stimulant and they need something as a different product. And therefore, we have something called non-stimulant medications. They work differently. We're going to see that today, how they work differently. But the classic examples are Intuniv or guanfacine or Strattera or atomoxetine, and there's also another one which we don't use that commonly, but that's called clonidine. Now, they work differently as compared to the stimulant group. So let's try to go through a little bit in detail how they work. Now, these medications work on brain tissue or synaptic level, and though we don't know exactly how they work, I think the research has shown some findings that are very important for us to know. For example, these two medications work on brain chemical that is called dopamine. And dopamine is one chemical that is essential for attention. So they enhance the concentration of dopamine at synaptic level. They also have some effect on another brain chemical called norepinephrine. So they work on two, dopamine and norepinephrine. These have more influence on dopamine. These have more influence on both of them. So there are a little difference between the two. Now, the classic ones in methylphenidate group is Ritalin, and LA stands for long acting. Now, we use that since 1955 in this country, and it has gone through various changes, such as Concerta, which I don't have here, but Ritalin, which is methylphenidate, initially was a tablet that you had to give 2 or 3 times a day, and that was cumbersome because children had to go to school nurse and take medication. To avoid that, we started extending the duration of action from 4 hours to 8 or 10 or 12 hours. Now, that is something that came later on. And the first one that came in market was Concerta. And Concerta worked for about 12 hours. It's a very different pill. It is a pill that doesn't dissolve in GI tract, and it delivers medicine drop by drop for over 12 hours. Then the other one also, we got Ritalin extended for 8 hours. And the difference between Concerta and Ritalin was Concerta goes slow initially in first or second hour, whereas Focaline or Ritalin LA can go right away, and they have 2 peaks and therefore you can use them when they have some, excuse me, so let me go back. Concerta work for 12 hours and Focalin works for 8 hours. The mode of action is somewhat different, but they are long acting. We also have another long acting which is called Metadate, and that worked for 8 hours. Later on, the medicine methylphenidate was given in a different format, and that is called Daytrana. And this Daytrana comes in a patch. You open a patch and put on a gluteal area one day on one side and the other day on the other side. The advantage of that was that medicine would go slowly inside and work very well. There are so many other new ones that have come. One of them is Contempla, and Contempla was introduced about a year ago, and it does work differently. This medicine comes in a little pill form. You put in mouth and it dissolves within 30 seconds, and absorption is quite immediate, and it lasts for about 10 hours. Quilivant is a liquid form which is in a long acting, and those people who cannot swallow pill, this was quite useful for them. So you can see that in this group, methylphenidate, there are many products. Most of them work for 8 to 12 hours, and so your pediatrician or physician will choose the right one that will work for your child. Now, sometimes they do not work as good as they should, and therefore we have another choice, and that is called amphetamine group. In amphetamine group, we have two prominent medications. The first one is Adderall, and the other one is Vyvanse. Now, these two medications can do the same thing: increase level of dopamine and increase level of norepinephrine. And the duration is 12 hours for both of them, and they work quite well. So if you feel that your child is not responding to one of them, then the medication can be transferred to some other drug. However, these stimulants have some side effects. The side effects include decrease in appetite, or mood swings, or do not sleep well at night, or anxiety, and therefore they may not tolerate these medications. There could be some contraindications like tics, and tic means movement of face or grimacing of face or eye blinking, and when they have that, the stimulant can make them worse. As a result of that, you may have to choose some other medications. And it's so nice to have something different, and that is non-stimulant medications. Now we have at least two which work quite well, and one is Intoneve or guanfacine, and the other one is Strattera, which is atomoxetine. Now they do not work on dopamine. They work only on norepinephrine brain chemical. So they are so different than what we have seen here. The side effects include saying decreased appetite, especially on Strattera. But these two medications are kind of notorious to cause drowsiness and tiredness. So the best thing is that you use this medication in the evening or at night, especially before child can really get used to medication. So most of my patients, they start this only at night for first or second week, whereas stimulants are given always in the morning. And we'll see briefly what are the side effects as we go down. But they work quite well in some cases. Now when we look at the efficacy, I feel that stimulant is the way to go. If your child does not have any contraindication and they need medicine, I would always recommend stimulant. That's what I do in my clinical practice. Now, those who cannot tolerate these stimulants or have some side effect where I cannot use that, or they have some contraindication like tics or anxiety or mood swings, then I would use non-stimulant. Okay? Now, when we go back, side effect of this, loss of appetite, sleep issue, irritability, anxiety, and therefore you have to be careful and watch them. Monitoring of blood pressure, heart rate, their weight, their height is very essential on this medication. The side effect of this, at least initially, drowsiness. They may feel sleepy. Therefore, don't start medicine first thing in the morning. You may would like to start this in the evening until child get used to it, and then you can switch in the morning. The other side effect, again, especially in Strattera, is a mood issue. Though it improves anxiety and it can help depression to some degree, though it's not approved for that reason in this country. Drowsiness, decreased appetite is another common side effect of this one. And no matter what medicine or which one you choose, you've got to monitor them. Now, this strategy works in about 65 to 70% of children. About 10 or 20% of children will have some side effect on this medication, and therefore you may have to find alternative sources. Now, that could be behavior management, modification at school, giving them some counseling. And what I do in my clinical practice is use all therapies, all management together, as we call it, holistic integrative approach, which I have found is the best way of managing ADHD. And that includes nutrition, that includes dietary management, and therefore, when you use dietary or nutrients along with medications and your other therapy, the effect is much better. If you need more information, please visit our website, brainmindbody.com, and you will see various other things that are available that can be useful for your child, or if you're adult, it can be useful for you. So thank you again. My name is Dr. Karnik, and I'm a pediatric neurologist practicing in Austin, Texas. Thank you. Have a great day.